Hello and Assalamu alaikum. My name is Dr. Abdullah Iqbal. I am a consultant general surgeon and a laparoscopic surgeon. In this video, I will tell you about the reasons of constipation and the complications that the constipation can cause, that is the piles or hemorrhoids. And I'll also tell you how you can treat your constipation. So keep watching this video till the end. Actually, piles and hemorrhoids is a different name of a same condition. Some people call it piles and the other people call it hemorrhoids, and this is their own preference. What actually happens in this disease is that the veins carrying blood away from the anal canal becomes dilated, and when the patient passes a stool, it causes irritation on the veins, and this may or may not result in bleeding, and we call it hemorrhoids or piles. There are two classifications of hemorrhoids. The first is based on whether the hemorrhoid bleeds or not. So if the hemorrhoid bleeds, we call it a bleeding hemorrhoid, and if it does not cause bleeding, then we call it a non-bleeding hemorrhoid. And the second classification is based on the anatomical location of the hemorrhoid. So if the hemorrhoid is found within the anal canal and cannot be palpated from outside, we call it internal hemorrhoid, and if it is present outside the anal canal, then we call it external hemorrhoid. There are many causes of piles or hemorrhoid, but the most important cause of hemorrhoid is constipation and the pressure one exerts during passing feces. These two reasons actually result in hemorrhoids. There are many other reasons of hemorrhoids, such as decreased water intake, junk foods such as burgers, chips, etc., depression, obesity, and more importantly, self-medication for constipation without a doctor's prescription. Specifically, those people who are taking constipation medicines for years have more chances of developing hemorrhoids. Also, those people who have a sedentary lifestyle, that is those who have less or no physical activity, have increased chances of developing hemorrhoids. In addition, pregnancy also increases the chances of developing hemorrhoids. So you people must be thinking that, okay, we have a constipation, but how can we prevent ourselves from developing hemorrhoids? So the only way to prevent oneself from hemorrhoid is to get rid of constipation, and this is only possible when you make some changes in your diet. For example, increase the quantity of fiber in your diet, and there are many ways of increasing fiber, and the different ways are taking more fruits and vegetables, use whole grains, more legumes, etc., etc. Also try to drink as much water as you can and avoid abusing constipation medications. These are simple techniques and the only way to prevent oneself from developing hemorrhoids. Now coming back to the topic, let me explain you the 4 stages of hemorrhoids. The first stage is when the patient only bleeds and there is no swelling. In the second stage, there is a swelling that comes down with defecation and goes back on itself. In the third stage, there is a swelling in the anal canal that comes down with defecation and it has to be manually reduced inside. And there is also some itching and pain during defecation. In the fourth stage, the patient usually has a swelling which cannot be reduced on manual repositioning, and the swelling is painful and tender, and the patient at this moment need a hospital admission and painkillers to reduce the swelling of hemorrhoids. Usually the patient presents in the emergency with complaint of weakness, anemia and nausea, and among those, most of the patients keep their disease hidden, and even their family don't know what's wrong with the patient. And in these circumstances, before we treat patient for hemorrhoids, we have to transfuse them blood and give medications to prevent further bleeding. here that initially the treatment of piles or hemorrhoids is possible with medication. That is, in the first stage of hemorrhoid, in which the patient only bleeds and there is no swelling, the medications can help patient to get rid of hemorrhoid. However, in the second stage, the patient needs a small procedure that is done with the help of a small instrument without the use of anesthesia. In this procedure, a rubber band is ligated on the base of the hemorrhoid, and this is a simple procedure and can be done in the outpatient department, and the rubber band that is applied sheds around in 2 to 3 days and causes necrosis of hemorrhoid, and the patient does not get any further bleeding thereafter. In the third stage, the patient needs operation, and I'll tell you the details of it in a while. But in the first stage, the patient has to be admitted in an emergency, and the patient is given medications to treat swelling and pain of hemorrhoids. We need to perform some tests before going to the operation of hemorrhoids or piles. That includes some blood tests and a chest X-ray. Usually the patient is admitted around 4 hours before the procedure and is kept nil per hora during this time. The procedure takes around 15 to 20 minutes, and this operation is done by giving anesthesia in the spinal cord, which makes the lower limbs numb. This numbness can remain for the next 3 to 4 hours, after which the patient can move freely. During the procedure, the dilated veins are ligated with the help of the sutures, and recently without the suture with the help of the ligashore. And the dressing is done, which is removed on the next day or at the time of the first stool, whatever comes first. In the same day, the patient is discharged while he is prescribed some medications and advised some precautions and maneuvers. Usually, patient becomes alright in around 10 to 14 days. Hemorrhoids operation is quite a safe operation, and there are least complications associated with it. But we do explain some complications that may happen in some patients, and these complications include persistent bleeding after operation, infection of the operative site, and decrease in the ability to stop stool. But these complications usually go away in 10 to 14 days and are more likely to develop in those patients who have more than 3 hemorrhoids and the disease is quite old and complicated. If you or any of your family member or friend has a problem related to piles or hemorrhoids, I suggest you to contact your doctor and discuss the possible treatment options for your condition. If you have any question or any query, feel free to ask us and do comment in the comment section below. Me and my team will make sure to answer your query as soon as possible. If you like our video, then please give big thumbs up and share it with your friends and family, and do not forget to subscribe to our channel. Take good care of yourself and your family. Goodbye.